A previously healthy middle-aged man, with no medical history, surgeries, alcohol, or smoking habits, begins experiencing escalating symptoms. Initially feeling tired, he later develops worsening fatigue, lightheadedness, headaches, and a reduced appetite. Welcome to Healthy Habits, your go-to channel for all things wellness and lifestyle. Whether you are a long-time subscriber or stumbling upon healthy habits for the first time, I invite you to join me on this journey. Watch the entire video, and let's embark on a path towards a healthier, happier, and more vibrant you. After enduring these symptoms for 8 months, he decides to consult a doctor. Blood tests reveal severe anemia with a notably low hemoglobin count of 3.1, the normal range for males being between 13 to 17. He denies any prior issues with bleeding. Consequently, the doctor recommends a blood transfusion and an urgent investigation for the symptomatic anemia. Following the transfusion of 3 units of blood, his hemoglobin levels return to normal. The doctors inquire about family history of cancer, but the patient denies any such history. Blood tests do not reveal the cause of the anemia, but the diagnosis turns out to be iron deficiency anemia, typically associated with bleeding. Despite the patient's denial of any visible bleeding, the doctors suspect a gastrointestinal issue. A CT scan of the abdomen reveals a 9 cm thickening in the proximal ascending colon and enlarged lymph nodes, strongly suggesting colon cancer. More information was necessary for the diagnosis. A chest CAT scan was performed to check for metastases, showing none. The triple-phase liver CAT scan also indicated no metastases. Carcinoembryonic antigen, CEA, levels were checked, which are often elevated in colon cancer. The patient's level was 6.1, while the normal range is less than 2. Subsequently, a colonoscopy identified a 30 mm ulcerated circumferential mass extending from the ileocecal valve to the hepatic flexure. 2 smaller growths, 20 mm each, were also found and removed during the procedure. Histopathology results showed the large mass to be an invasive, poorly differentiated adenocarcinoma, while the smaller growths were diagnosed as tubulovillous adenomas. Following surgery to remove the right side of the colon, the patient commenced chemotherapy. After 6 months of chemotherapy, the CEA levels normalized, and a follow-up CAT scan showed no signs of metastases. Why do otherwise healthy young individuals develop colorectal cancer? When diagnosed in patients under 50, it's termed young-onset colorectal cancer. Over the past 4 decades, there has been a substantial rise in both the incidence and mortality rates of this condition. Roughly 1 in every 5 colorectal cancer patients is under the age of 55, and it's a leading cause of death in the age group of 20 to 49 in the U.S. The annual occurrence of young-onset colorectal cancer has increased by 5% over the last 2 decades. Due to the lack of routine screening for colon cancer in young people and the tendency for doctors to consider it a late possibility in an otherwise healthy young patient, the diagnosis is often delayed, resulting in the cancer being more advanced by the time it's identified. The American Cancer Society and the U.S. Preventive Services Task Force recently updated colonoscopy screening guidelines to now include individuals aged 45 to 49. The surge in young-onset colorectal cancer is attributed to lifestyle behaviors and environmental factors influencing disease risk. Smoking, heavy alcohol consumption, and insulin resistance, often linked to consuming highly processed foods, are associated with an increased risk of colon cancer. These factors, obesity, type 2 diabetes, insulin resistance, and diets rich in highly processed foods, are strongly connected to the incidence of colon cancer. Highly processed foods lack fiber, contain added sugars, refined carbohydrates, and potentially harmful additives, including known or suspected carcinogens. Hence, the higher prevalence of colon cancer in younger individuals is likely not coincidental. The most prominent risk factor is a family history of colon cancer, with 1 in 3 young-onset CRC patients having a relative with colorectal cancer. Usually asymptomatic initially, colon cancer may present warning signs, such as rectal bleeding, changes in bowel habits, unexplained anemia, abdominal pain, or weight loss. It's crucial to be vigilant about these symptoms, particularly in young individuals with risk factors. To watch our video on signs of colon cancer, click the link on the pinned comment. Before we conclude today's video, I want to express my heartfelt gratitude to each and every one of you for joining us on this journey towards better health and wellness. Your support means the world to us, and we're thrilled to have you as a part of our Healthy Habits community. If you found this video valuable, please consider giving it a thumbs up and sharing it with friends and family who might benefit from it. And hey, don't forget to hit that subscribe button and ring the notification bell so you never miss out on our latest content. If you value the knowledge and insights we provide and would like to support our channel in a meaningful way, please consider making a donation. Your contribution, no matter how big or small, helps us continue our work, improve our content, and reach even more people. It's your support that keeps the wheels turning and motivates us to keep creating content that matters.